Intellectual disability is a disability characterized by significant limitations in both intellectual functioning and in adaptive behavior, which covers many everyday social and practical skills. The disability originates before the age of 18. The most common conditions connected to intellectual disabilities are Down syndrome, Fragile X syndrome, PKU, and fetal alcohol syndrome. According to data from the U.S. Department of Education, approximately 400,000 children between the ages of 6 and 21 were identified as having an intellectual disability and receiving special education during the 2011-2012 school year. Over the years, the number of students classified as having an intellectual disability have decreased significantly for many reasons. These reasons include benefits from prevention, early intervention, changing definitions, and improved referral tactics. States are now required to report the number of preschoolers receiving special education according to their disability label. This requirement represents a shift away from allowing states to use the term developmentally delayed when reporting preschoolers with disabilities. IQ is defined as the ratio between a person's mental age and their chronological age. The IQ test is a major tool in measuring intellectual functioning, which is the mental capacity for learning, reasoning, problem solving, and so on. A test score below or around 70, or as high as 75, indicates a limitation in intellectual functioning. Other tests determine limitations in adaptive behavior, which covers 3 types of skills. The first set of skills are conceptual skills. These include language and literacy, money, time, and self-direction. The second set of skills are social skills, which include interpersonal skills, social responsibility, self-esteem, social problem solving, and the ability to follow rules. The third and final set of skills are practical skills. These are activities of daily living, such as personal care, healthcare, transportation, schedules or routines, and safety. Individuals with intellectual disabilities often experience difficulty focusing their attention, maintaining it, and selectively attending to relevant stimuli. They struggle with memory. Generally speaking, the more severe the cognitive impairment, the greater the deficits in memory. Short-term memory suffers more than long-term. There is a deficiency seen across all areas of academic performance, but reading comprehension is the weakest area. It is not unusual for students to have heightened anxiety when approaching a learning situation. As a result of this, students are less goal-oriented and lack motivation due to a history of failure. Students also experience difficulty generalizing knowledge acquired in one context to a new or two different settings. Speech and language disabilities are common among individuals with intellectual disabilities. Given this, these students experience a great deal of difficulty with academic tasks such as reading that require verbal and language competency. From a social and behavioral perspective, students with intellectual disabilities usually lack social competence. They have poor interpersonal skills, so rejection by their peers is common. Individuals frequently exhibit socially inappropriate or immature behavior. They also have lower self-esteem coupled with low self-concept. Instruction for students with intellectual disability should not take a one-size-fits-all approach. Curriculum needs to be individualized but must also be comprehensive. Academic as well as adaptive skills need to be included. Curriculum must provide maximum access to the general education curriculum while attending to specific curricular needs that are missing. Instead of teaching students a lesson all at once, teachers should break down their lessons in simple, easier-to-manage steps for these students. This will help keep frustration levels down and enable learning to take place. Wait until the student masters the baby step before moving on to the next one. Introduction to new ideas should be done in a physical, hands-on approach. Using manipulatives when teaching math or taking field trips to give students a meaningful experience are just a few ideas. When students are able to make real connections to the world around them or physically explore a concept, the knowledge will stick with them and help with their generalization deficiency. Everyone appreciates a pat on the back. Positive feedback will encourage students with intellectual disabilities to keep on trying, which will address their lack of motivation. If a student masters a concept or meets a goal, it is important to reward or applaud the student immediately. Having a pizza party at the end of the month for a job well done 3 weeks earlier is not going to make a connection with the student. Music is a wonderful motivator among all children, and particularly ones with intellectual disabilities. Keep in mind that each child is different, but overall, most students are positively influenced by music incorporated into lessons. Making a simple, catchy song to go along with a concept is a fun way to engage the student and also helps them remember information, which helps with their memory deficits. Patience is key when teaching students with intellectual disabilities. Students with certain disabilities can be unpredictable in what they can learn and what might set off a certain behavior. What might appear to be a temper tantrum is often the student's way of telling you, "This is too hard, I am frustrated," or "I am tired, I need a break." Take the time to learn the individual child's needs and who they are. If either the teacher or student are feeling overwhelmed, it is okay to stop the lesson and resume when both student and teacher can handle the lesson pace. It may take a while for students to make some progress, but if you're patient, it will be priceless when they do. Cooperative learning encourages students with varying strengths and abilities to work together toward achieving a common goal. In this strategy, the teacher structures the task in a way that each student significantly contributes to the completion of the activity according to his or her ability. Careful planning and consideration of the needs and abilities of each student is needed in this strategy. Cooperative learning has been shown to increase opportunities for students with disabilities to experience success in school. This enhances self-esteem of individuals with special needs and increases the acceptance and understanding of children with disabilities. Students should always be provided with multiple opportunities to practice skills in different settings. By having students practice specific skills across multiple different subjects and topic areas, they are better able to learn that specific skill. Students with intellectual disabilities have trouble with generalization of knowledge, so providing these opportunities will help with that. Students with intellectual disabilities do best in learning environments where visual aids are used. This can include charts, pictures, and graphs. These tools can be used to introduce and teach new material, as well as help students understand what behaviors are expected of them. Charts can map students' progress and provide positive reinforcement for appropriate, on-task behavior.